morning, my colleagues, friends, and listeners. So today I'm going to talk about to-day market approach for Myanmar. So my apology if you are not familiar with BSI program. So because I'm going to talk about condom and sex on Sunday morning. So it is about the need for private, socially marketed, and public setup to work together for a sustainable economic market. So before I start my presentation, I'd like to thank my colleagues and co-author from BSI, local originated already, and also from the University of California for their support and contribution to write this paper. So the key message I'd like to give from this presentation is the economic market in Myanmar has been stagnant due to limited demand among the key population, such as female sex workers, their clients, and men who are separate men. And because there is also the dominance of free and socially marketed condoms in the market, and also a neglected private setup, because they mostly want to talk about their financing and then deliver their health care bill. So the private setup was neglected. As the public health programmer didn't consider adequate the role of private setup in healthcare investment. So I'd like to give a background of what BSI has done for HIV prevention in Myanmar. So for over 15 years, BSI has implemented economic social marketing programs. That is distribution of subsidized branded condoms targeting female sex workers, MSM, and their clients. So more targeted strategies in line with national HIV immunology in the country because it is concentrated in nature. And also, we have seen over the last 5 years a significant decrease in prevalence of HIV among those targeted population. But we have concern about our pricing strategy because we didn't change our price for the last 5 years, and we have more than 80% commercial market share. We are concerned about the sustainability of the common brands, the market, and also the sustainability of the private sector market. And we found out that through the market approach, we have used proven methodology to do such kind of analysis and decision-making. So TME is defined as a system. We see the market combination of three setups: the private, public, and socially marketed setup. We see the market as a system where those three setups work together. So some even argue that TME is central to the future of social marketing. So this is the desired outcome of TME, so that we see the market into three setups. The first, the commercial setup. The second, social marketing setup. That is satellite and distribution of products. And the third one is the public setup. So this desired fact is that over time, there is the growth of all three setups for both private, socially marketed, and public setup. So that will increase the use of product and service and reduce the risk of behavior. And also that will increase the equity among all three setups. So that poor people, they should get access to free service based on their willingness to pay. But slightly richer people, like lower and the middle income people, so they should get access to subsidized product and service. But for the rich people, they should not get access to free and subsidized product. They should buy from private sector. So over time, when the economy grows, so that there should be more equitable use of product and service among all population, depends on their willingness to pay. And also the sustainability. As in long run in future, there should be a growth of private sector and the healthiness of private sector. And also we see the TME as an easiest strategy of social marketing programs. And also it is also a form of public-private partnership. So that we can decide in long term, like 10 years, 20 years later, how a social marketing program can withdraw from the country. Because social marketing programs are also funded by the programs. So the method we use in this study is there are four main primary indicators. One is the universal need. That is the total number of economies to each universal coverage for the market. That is total number of suspects for the certain period. The demand is the proportion of the need that what the economies use. And the equity is the proportion of poor people use condoms. The subsidy here is the donor subsidy for free and social market condoms. And sustainability is the growth of commercial market. And we analyze 3 years data from several sources. So the data on economy use and equity came from BSI Myanmar population-based survey. So that we have this kind of behavior study for over 6,000 people for 2 years period, 2008 and 2010. And data on market share, broad trade, and number of economies were from our review audits. How we assess our economic situation in the market, and then ULA's reports. The equity pushing was a bit tricky because usually when we have to compare with the equity the wet line of general population, and we don't have the DHS here. So that we use national TV prevalence study and the data from the national TV prevalence study and the cross-reference with the BSI behavior survey. So our findings. So between 2008 and 2010, in 2008 there were 104 million suspects, and in 2010 there were less suspects in 2010, only 98 million. And this is the state that included the suspect. Condom use was increased between 2008 and 2010, but state that included the suspect is stayed more than 50% of compared to included the suspect. So, but we also saw a significant increase in condom use among female sex workers from 12.9 million to 12.7 million. So there were no significant changes between our 3 target groups. So market volume and share. So in 2009 and 2010, total condom market is about 344 million. So no significant change. So this blue number represents market share of commercial condoms. That is 4.8% in 2009, 5.7% in 2010, and 4.8% in 2011. So there is no significant change. And green is the market share of social market condoms. That is 53%, 51%, and less than 40% in 2011. And also we see that there is significant increase from the free condoms distribution in the market in 33% to 51% in the country. And also this is the number of percentage of the leakage of those free condoms in the market from 8% to 2.9%. And also we see that for condoms market price is $0.05 US, and compared is 3 times lesser than price of condoms. But even if we free condoms, the market has higher price than for condoms. So when we see the wet penile, so the female sex worker, their generate wet penile is the same as the general population wet penile. But for men who are with men, MSM and their main clients, and they are much richer than general populations. So market value and subsidy. And we see the total number of condoms reduced in the market from 2009 to 2011. And that's why the value of those condoms in the market reduced between 2009 and 2011. And at the same time, because of a lot of free condoms are distributed in the market in 2011, so the donor subsidy increased in 2011 for free condoms. So our discussion and recommendation, so we should have a sustainable condom market. We like to recommend to increase the demand of condom among the population. We have to reduce 54% and put access to less than that. And decrease the dominance of free and socially marketed condoms. And grow the commercial setup. So ensure that free and socially marketed condoms, we're not crowding out the commercial brands in the market. And to improve use of donor subsidy and target to most in need. So the next step, we have to build a strategic partnership with the private sector. It's really hard because even PSI, we try to engage with the private sector, economy distributed in the country because they have less profit. They don't have any money to promote. We promote them, but it's very difficult to share the idea. And promote and sell commercial brands to wealthier consumers, and then introduce middle-range economy to create the price gap between social market and commercial economy, and work with the other public sector for their actually focusing of economics in the market. So the last slide, to conclude my presentation, the Myanmar economic market is complex. So we have to consider an intended effect of subsidy on the market. And to the market approach is needed for private-public partnership and the growth of private sector in future. And as long as we aim for the economic growth, and the private sector should be growing. And we all have to work together for better targeting of our economy. Thank you very much.